Hi, I'm Sheila Stevens. I'm a student at UAH in the nurse practitioner program, getting ready to do a diabetic foot exam on a 36-year-old diabetic female diagnosed approximately 13 years ago. Hemoglobin A1C has been ranging from 6.5 to 7.1, and fasting blood sugar normally runs around 170. Currently, have there been any changes in your foot since our last evaluation?
No.
Any problems with your shoes?
No, ma'am.
What about, have you noticed any blood or discharge on your socks or hose?
No, ma'am.
Do you smoke?
No, ma'am.
Okay. A couple of things it's really important is, do you have ever had an ulcer on your foot or noticed any kind of foot ulcer history there?
No, ma'am.
What about any pain when you're with your calf muscles when you're walking? Is it relieved by rest?
No, ma'am. Sometimes I get leg cramps at night.
Okay. I noticed when you walked in, your gait or the way you walk is very normal. Everything looks good there. Any problems? I may have asked you this with shoes.
No, ma'am.
Okay. Do you break in new shoes? I mean, slowly? How do you normally do that?
Slowly, yes,
I'm
ma'am.
going to roll this up. One of the things is really important that as a diabetic that you do have your foot examined at least annually. I'm going to be checking for, I've got, I guess as you can see, a monofilament and also a tuning fork, and I'm going to be checking for signs of neuropathy. Also, while I'm doing it, I'm expecting your feet are nice and warm, which is normal. Checking your dorsalis pedis, which is a +2, which is a very good sign. And also your posterior tibia, that also is a +2, which is very normal. One of the things I'm also going to check is your musculoskeletal strength. What I'm going to do is have you kind of resist, push, good. Very good. I noticed that you got a little sore here. And when did you first notice it?
Oh, for whitewater rafting.
Okay, so you went whitewater rafting this
Yes,
weekend. So was that from the shoes or is that from being banged in the raft?
Both, yes, ma'am.
Okay, so we definitely want to keep a check on this place right here. The other thing is I'm expecting your toenails. Who has been clipping your nails? They're kind of jagged here. So what I want to do, one is check for callus, which you do have one here. Check for thickness. I'm looking for possible some fungus infection. And then I'm also looking at the hair, and you do have hair growth. That's a good sign for good blood circulation. One of the things is most insurances will pay for you to have your nails clipped every 3 months by a podiatrist.
Okay.
Or by a licensed professional. That would be something I would suggest instead of trying to do it yourself. As they're jagged, you want to go straight across because you want to make sure that you don't get any kind of ingrown toenails. Okay. The other thing with this callus and the dryness, I would just suggest some cream that's good for your feet that will help the moisture. Obviously, you don't want to put a lot and then put your shoes on it and then it be too moist. But when you're going to be out just sitting around, I would definitely add some cream to your feet. Also, I'm looking for redness, swelling, and deformity. I'm checking for what they call Charcot foot. I don't see anything there. Everything looks really good here. One of the things I'm going to go ahead and do with the monofilament is get you to close your eyes. And if you will say yes to every time you feel it, this does not hurt, it's nylon, and I'm just going to check it. So if you will close your eyes.
Yes, ma'am. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
Good. Good. The other thing is I'm going to use is the tuning fork to check the vibration sensory on it.
Yes, ma'am.
This does not hurt either. If you would let me know when you stop feeling this one, okay? Yeah.
Okay.
Good, very good. Is there any questions? I know I've asked you a ton of questions. Is there any questions I can answer for you?
No, ma'am.
All right. Well, I appreciate you taking time to let me do your assessment, and I plan on seeing you back next year. Have a great day.